Welcome back. Sakuvusela na ulosonza kuzivulela lo mhlahlelo nekusile breakfast show. We had mentioned earlier Guti was speaking to Dr. Jason Earnshaw from the Mbabane clinic on the importance of oral hygiene. He's joining me now via Zoom call. Dr. Misana Naya about the importance of the oral hygiene. Good morning and welcome, Doctor.
I'm doing great.
Yes, thanks so much. We're talking about the importance of oral hygiene. Please explain to us why is this important? Why is this important, and also just give us an insight on the misconceptions that the public has on dentists and dentistry.
Okay. So to start with the second part, the misconceptions, I think the most common misconceptions that people have are that dentists are there to remove teeth or to fill teeth, when in actual fact, the dentist's job is to diagnose and to treat everything that starts from here and ends here. So that includes your teeth, it includes your tongue, the gums, the mucosa that surrounds your cheeks down to your neck if there's a problem there. So that's the fillings and the extractions is a small part of dentistry. And then the importance of good oral hygiene. You can essentially start from the fact that the mouth is the portal to the body, right? So everything that enters the body enters through the mouth, whether that's food, water, or even air you can breathe through your mouth. And if your entry point is problematic, then things won't get into your body. So we need our mouths to be able to feed ourselves, to be able to drink. And if we have problems with our teeth, and then that is hampered. But then it actually goes deeper than that, because when a person comes and has a tooth problem, initially that can start out as just a hole in the tooth and there's a bit of pain. But then if you leave that, it can lead to loss of the tooth. Now you start with the initial thing of the toothache. And the toothache can stop you from eating. In kids, it can hamper their growth. It can give them a fever. It can stop them from going to school. It stops you from going to work. It stops you from being productive. Now, after the toothache, it can lead to tooth loss. That also has implications, because with tooth loss, you're not able to eat as well. That has implications for diabetes, for example, because in order to control your diabetes, you have to maintain a certain diet, and you are limiting your diet if you have fewer teeth in the mouth.
All right, so, Doctor. So, what are some of the solutions that we can that are there, to prevent these problems that you have seen with your clients?
Okay, as far as prevention is concerned, and as doctors, you're always trying to prevent rather than to treat. That's always the best way to approach a patient. So prevention starts at home. It starts with you brushing twice a day with fluoridated toothpaste. I see a lot of patients using fluoride-free toothpaste. That's it's not very good for your teeth. You might as well just be using water if you use fluoride-free toothpaste. So it starts at home with you cleaning your teeth, and then when your adult teeth start to grow from the age of 5 onwards, your posterior teeth, the teeth at the back, the molars, what you can do is go to the dentist and get something called a fissure sealant. A fissure sealant is a material that goes into the grooves of the tooth to prevent food getting stuck there and then starting a place of rot. So that is one prevention. Then when it comes to treating, there's nothing in the mouth that can't be fixed, right? It all depends on what a patient can afford, unfortunately. So if you have a hole in the tooth, if you come because you have a sharp pain with cold water, or you have something sweet or air going through the tooth, that can be fixed simply with a filling. You just clean away the rotten part of the tooth, you plug it up, and the patient is fine. If the patient comes with a toothache, it means that the neurovascular bundle, the nerve inside the tooth, is infected. In that case, it's a bit more serious. You have to open the tooth up, remove the nerve from inside, clean it out all the way to the bottom of the root of the tooth, and then you try to disinfect it over a period of time. After it's been disinfected, you put some chemicals inside and you leave them there. After it's been disinfected, you have to fill the whole tooth up, right? So that's a solution to a toothache. If you have gone beyond that and you've lost a tooth, there are mainly 3 solutions. The first and the cheapest one is false teeth, right? Now, false teeth, commonly it will be a plastic appliance that you put into the mouth. You can use it for appearances, for speaking, and also for eating, right? But when you go to sleep at night, you have to take it out. That is the cheapest way to replace teeth. A more expensive way to replace teeth is with something called a bridge. It's a permanent replacement of a tooth. And essentially, in that case, what you do is you have a tooth here, and a space in between, and you want to fill that space. So you trim this tooth, you put crowns, which are caps, onto those teeth, and those caps hold the false tooth in position. And it's one single unit that gets cemented on. That is the most affordable permanent solution for tooth replacement. The best and most expensive form of replacing a tooth is with an implant. And with an implant, you have a titanium screw that goes into the bone, and you attach a crown onto that titanium screw. And essentially what you have is your tooth back. It's like having a tooth back in the mouth.
Right. So, doctor, you did mention the importance of the usage of toothpaste. There's so many different types of toothpaste at the store, and I won't mention the brands. How do I know this one is good for my teeth? And also the usage of a mouthwash, is that safe for my teeth?
Okay. So yeah, without mentioning brands, um, there's a saying amongst motorbikers, which is that you get a $200 helmet if you think you have a $200. And then also, so the toothpaste must be Friday toothpaste. And what you tend to find is that a lot of people, believing that the harder a toothbrush is, the better they clean their teeth, they actually damage their teeth in the process. If I were to give you a nice wooden table, and I give you steel wool and a lint cloth, and I say, please polish the table, the lint cloth will polish, but the steel wool will damage the table. It's the same thing with teeth. If you're using a hard toothbrush, you are damaging your gums, you are damaging the root, you are damaging the tooth. So I always encourage patients to try and pick the softest toothbrush they can find in the store. All the different brands make Colgate, Oral-B, all these, they make soft toothbrushes. So you must look for soft at the top. Medium, if you can't find, avoid hard.
Right, doctor. I want us to talk about braces. We see a lot of people, especially influencers these days, they install braces on their teeth. What exactly is the importance, the purpose of braces? Is it for being fancy, or they actually do help us straight?
Reasons. There could be the patient's reason, which is for aesthetics. They want to improve their smile. And then there can be the doctor's reason, which is for function and for maintenance of oral hygiene. If you have your teeth sitting straight like this, right, it's easy to clean. You brush there, sorted. But if you have your teeth crooked, it is very difficult to clean in between these spots over here. And so you tend to find that people who have teeth that are crowded, as in overlapping each other, they tend to rot in between, and it's very difficult to keep those clean. You have to be very vigilant with your oral hygiene practices. So braces will help alleviate that. They will help with the appearance of the patient. And then also you get some cases where the malocclusion, as it's called, the disruption in the articulation of the teeth, so the teeth not fitting together properly, it can be so extensive that the teeth actually damage each other every time they interact. Every time you close your mouth, the teeth are damaging each other because they're not sitting in the right position. So braces will sort that out. Now, braces can start as young as 7 years old. You can start intervening then. And there's actually, I meant to say also that there's actually multiple ways that you can straighten teeth, not just braces, right? There are multiple different appliances. You might have to use braces as well, but you might have to, for example, expand the bone. That's not braces, that's a different appliance that does that. You might need elastics between the braces in order to try and move specific teeth into specific positions. So in short, braces work. And if you think that you might need, or your child might need, just go to a dentist and just find out, and you will be told.
All right. Lastly, doctor, what are the services that you provide at the Mbabane Clinic, and also your availability at the clinic?
Okay, so Mbabane Clinic provides everything, right? So everything that you find everywhere outside. The only thing that we haven't gotten into yet is implants, placing of implants, but that's something that we are going to get into soon. The one thing that I will say, though, that Mbabane Clinic provides that nobody else does is to be able to do the same procedures that you would do in the chair in theater. Now, you find that you have, in some cases, children who have neurological disorders, say maybe they're autistic, and they can't interact effectively with the clinician or with their parents, and so they want to sit still in the chair. You can have children and adults who have motor problems, so something like cerebral palsy, where everything's cognitively fine and they want to be able to sit still, but they can't because they can't control the body. And you have to be able to sit still in the chair because it can be dangerous if you're not seated still. And then you actually have a case coming up next week, Monday, where you have people who are so traumatized by a prior experience with the dentist that they are too scared to sit in the chair. You can't inject them. Every time you approach with the syringe, they freak out. That's called dentophobia. Dentophobia is a very real thing. And it is an irrational fear of the dentist. You just can't. They may want to be able to cooperate, but something just comes over them and they react to it. So with those patients, we take them to theater, put them to sleep, and then do the work that we have to. And only Mbabane Clinic provides that. And then a tangent of that is young children. All right. So kids who, for me, it's an arbitrary number. I picked the age of 10. Kids younger than 10, I prefer to take to theater if we are going to do an extraction of the tooth. And especially if it's teeth at the back or if it's multiple teeth in the mouth. And the reason for that is you can, in most instances, explain to an adult or to an adolescent what the problem is and what the solution to the problem is, and get them to cooperate. But kids younger than 10, some will, most won't. You'll have to hold them down in the chair, and that's quite traumatic to the child. And even the ones who do cooperate the first time around, the next time they have to come back to the clinic, they don't want to step inside. I've had instances where, not here, but when I was working in government, where kids would be holding onto the door and the parents try and pull them in because they're too scared to go inside. So in those cases, kids younger than 10, I prefer to take them to theater. You give them a mask, they breathe in a gas called sevoflurane, they fall asleep after 10 seconds, right? We wait about a minute, make sure everything's stable, and then I come in and I remove the teeth. It takes me about a minute at most to remove teeth. I removed 12 teeth from a child last week, and that took me 2 minutes to do. And then we stem the bleeding, and then the child wakes up after about 10 minutes, right? So from beginning to end, the entire procedure will take at most 30 minutes, usually about 15 minutes. And it is by far the best and safest way to treat a child. And that is something that we offer here, and none of the other private clinics will offer to you.
All right. Thanks so much, Dr. Earnshaw, for your time. Have a good day.
Thanks, you too.
All right, simbukele besikhulumisana naye Dr. Jason Earnshaw from the Mbabane Clinic lo ngu-dentist asichazela nje bomgcokabe ukuklina wona ematinyo uyatholakala ke khona lapha eMbabane Clinic from Monday to Friday uyabe lapha uyabaklina amatinyo ebantwana kuya kubantu labadzala. We've come to the end of the show. Thank you so much for joining us. We'll see you tomorrow. Have a lovely day.